my name is Sergey, and I'm a patient of Dr Khaled Sabeh at Emirates Hospitals Group. I started having symptoms of heart palpitations and abnormal heartbeats a couple of years ago when I would go to bed and I would feel a slow heart rhythm or a quicker one. And so I guess I finally come round to be checking my heart with the help of Dr. Khaled. So I initially underwent a couple of cardiology tests with just a general cardiologist who told me that because of abnormal heartbeats, that required a specialty of an electrocardiologist. And given the hospital reputation, I thought of coming here for a checkup. So when I initially came to speak with Dr. Khaled, he looked at the test results. Well, we've ran obviously test results initially. He looked at them and he was of the view that the level of my abnormal heartbeats was too high. And so therefore we had two options. So one, to be on medication for the rest of my life, or number two, to go through a simple and with minimal invasion procedure called heart ablation, and so I opted for the latter. And so I found the procedure to be quite easy and good, and Dr. Khaled was obviously quite knowledgeable and assured me of all the steps during the procedure and how I would feel during the procedure and after the procedure, which helped me a lot with putting my mind at ease.
I'm Dr Khaled Sabeh. I'm a consultant cardiologist, consultant cardiac electrophysiologist. Sergey was referred to us because of his arrhythmia. In fact, when he came to see me, he wasn't aware of the seriousness of his condition. By the time that he came to us, his heart function had started to diminish. His heart function was a little bit weaker. And so, when we discussed this with him, we discussed his options, that his arrhythmia is in fact causing this weakening of the heart muscle. We decided initially to go with medication route. Tried the medication route, however, that was unfortunately not able to control his symptoms. As such, we discussed other options, more curative options, which is the ablation procedure. Sergey was very interested in proceeding with the ablation procedure. As such, we went ahead. Sergey was extremely comfortable throughout the procedure. He had no complaints whatsoever during all of his stay, and in fact, he was able to leave home early next morning. We saw Sergey in follow-up within around 5 to 7 days after that, and he was also very pleased. He had no more of his arrhythmia, and all his symptoms were gone. When we repeated his echocardiogram to see his function of the heart, after a month, we noted that his heart function had already improved and was back to baseline. Now Sergey can lead a completely normal life, completely cured of his arrhythmia.
But the most amazing thing is that following the procedure, my heartbeat got back to normal immediately. So we could see the result and I could hear the result as well when my heart was beating, so I could sense that it was fine. I definitely like to express my gratitude to Dr. Khaled for persuading me to go through this procedure, because I was in doubts and I had two minds whether that was worth the risk or whether I could opt in for medication. But I'm glad that I went down this route, and now my heartbeats are all normal, so I can live a normal lifestyle. So I want to thank all nurses, everyone who was involved in the procedure itself, as well as post care and any follow-up checkups that I'm still going through. So thanks everyone, and many thanks to the Emirates Hospitals Group.